This video will discuss ROE Dental Laboratory's main full arch prosthetic options, and they range from softer materials all the way through to nearly clinically indestructible materials. Let's go through each product quickly. The softer materials are called Ultra Nano. Ultra Nano is a crystal ultra composite tooth that is milled and then is bonded to a substructure. In this case, the substructure is Trilor, which is another milled substrate from a puck. It's an industrial strength material. And once we have the two components, we bond them together. So we bond the tooth section, all the teeth are essentially one tooth, and then we bond them to this substructure, and then we use a light-cured composite to add the pink. And then we bond in these cylinders. So this is called Ultra Nano Trilor. The next product is a little bit stronger. This has a titanium substructure, so it doesn't have the copings like the Trilor. Rather, this section connects directly to the MUAs with screws, and then it is bonded to a section of crystal teeth, just like the Trilor version, and then a light-cured composite is added. This is a little bit stronger because it has a rigid substructure, more rigid than the Trilor. So if you need to have a cantilever, or if you want to have less parts, then this is a very nice option. Both of these is critical that the laboratory designs a substructure for tooth support, because as with all dental materials, the substructure supports the superstructure and prevents shearing and breaking off of materials. Very important that the design is made right by the lab. The next line of products is all in our TLZ class. TLZ is our full contour zirconia, whether it's single crowns all the way up to full arch. And TLZ, we call it TLZ-IB for implant bridge, comes in an FP1, FP2, and FP3. FP1 is simply a crown and bridge version of the design. This will have cylinders in each section. Some doctors order them without tie bases or copings, but generally they're included. This has no pink, so it's more of a crown and bridge design, and it's very nice for the aesthetic zone or when you have a transition line that's in the smile. FP2 has a little bit of pink. Could have a little bit more than this, but usually just a little bit. And this is often also in the transition line or a situation where there isn't an excessive amount of vertical space to fabricate the restoration. Certainly want some nice photographs of the tissue in order to make this blend in. And then finally, the FP3, which is really the workhorse of full arch restorations. This is a solid milled puck of zirconia, and we use a translucent liquid ceramic to beautify it, to make it aesthetic, and even to add the pink. So no longer do we fire porcelain in the pink or even on the teeth because it's time consuming and really over multiple firings, it's really deteriorates the zirconia that we found, and it's just very time consuming. So instead, we use these liquid translucent ceramics to make it beautiful, and then a highly polished surface, and then the copings are bonded in. So this is nearly clinically indestructible, and this is our longest warranty item. So these are our full arch prosthetic options. Of course, there are many variations with full arch prosthetics, and we are happy to accommodate. Just let us know the design that you wish. Do our best to accommodate your needs. And to protect the full arch device, we send a mini comfort guard. This is a lower appliance that the patient wears at night or day. You can see it's unique. It's flexible, it's soft, but it has two little nubs here. They're called discluding elements. And what the patient will do is contact these two with the canines, and it'll remind the patient to open and stop clenching. So it's a deprogramming device that a patient can actually wear during the day to protect their investment. So it's a mini comfort guard.